Good morning and welcome to the North Slope Borough Community Health Hour. My name is Olivia Kim, Health Educator for the Prevention Unit. This show is brought to you by the North Slope Borough Health Department. In honor of National PTSD Awareness Month, which is observed in June, we'll spend some time speaking on this important topic and share an interview we did with Integrated Behavioral Health clinician Michelle Miller. PTSD or post-traumatic stress disorder is a mental health condition that can develop after a person experiences or witnesses a traumatic event. These events are perceived as being life-threatening and can involve serious physical or psychological injury. PTSD is often associated with veterans who experience traumatic events during war, but it is a condition that can affect anyone despite age or gender. According to the National Institute of Mental Health, about 6.8 Americans will experience PTSD at some point in their lifetime. The National PTSD Center states that women are more likely to develop the condition. About 8 of every 100 women, or 8%, and 4 of every 100 men, or 4%, will have PTSD at some point in their life. That percentage is 5% for adolescents at age 13 to 18, according to the NIMH. In Alaska, especially amongst Native American and Alaska Natives, those rates are much higher. The National Library of Medicine states that 16 to 24% will experience PTSD in their lives, with combat experience and interpersonal violence being cited as the leading causes. There is also a high correlation between alcohol abuse and PTSD. Amongst youth, a study found that 47% of Alaskan 3-year-olds had at least one adverse child experience in their lifetimes, and 9% experienced 4 or more. It is important to note that although many of us have traumatic events in our lifetime, not all of these events lead to PTSD. About 50% of women and 60% of men in the US will experience at least one traumatic event in their lifetime. That being said, it is important to discuss the potential effects of trauma as they can have lasting impacts on our lives and affect not only ourselves, but the lives of those around us. Trauma can evoke a wide range of emotions, including fear, anxiety, shame, guilt, sadness, and numbness. It can lead to shock, confusion, detachment, trouble concentrating, or distrust of others. Physically, trauma can lead to headache, stomach, and sleep issues. Trauma can also be passed down from one family member through the next and affect multiple generations, impacting mental and physical health and behaviors of individuals. The effects of trauma can be passed down through genetic changes known as epigenetics, through learned behavior and cultural transmission. Genetic studies have found that traumatic events have the ability to change gene function and that those changes can be passed down, leading to increased susceptibility to anxiety, depression, schizophrenia, PTSD, substance abuse, eating disorders, autism, and chronic conditions such as heart disease, stroke, diabetes, PCOS, and autoimmune disease. When a parent or guardian has unprocessed trauma, a child can learn unhealthy coping mechanisms, emotional dysregulation, and negative beliefs about themselves and the world. Shared cultural narratives around trauma, historical experiences, and social norms can also be passed down and keep the trauma cycle going. Trauma is complex, extremely personal, and difficult to process. When speaking or even thinking about our own trauma, it's normal for us to feel shame and fear. We may blame ourselves for the experience and try to disregard its true effects. Once trauma happens, it takes hold, grips tightly, and is difficult to let go. But it is only when we find the courage within ourselves to face that trauma, to face our emotions, our beliefs, and actions with compassion, love, and forgiveness that we can truly begin to be set free. Because trauma has such lasting and prevalent effects, it is that much more important to bring it to light. I hope that this conversation we're about to share with you helps to destigmatize trauma and shows you that understanding your own trauma can be a strength. And I hope you can see that no matter what may have happened to you, you deserve to feel safe, to be seen, to be loved. As someone who has faced my own trauma and found it within myself to work through it, I can tell you that it's one of the hardest and scariest things I've ever had to do. I let my trauma eat me up for years, and there were so many moments where I couldn't even begin to imagine a way out. My trauma isolated me and made me ashamed of who I was. But coming out the other side, I can honestly say it's one of the greatest gifts I've given myself. And it's also become one of my greatest sources of strength and resilience. It's allowed me to look at my past with compassion and grounded me in the belief that although trauma is a part of my life, it's not the entirety of who I am. If you are experiencing the effects of trauma, I want to say that you are not alone. There are resources and people out there who are willing to hear your story, who are willing to help. All it takes is one step, one conversation to open the door to healing and letting go. And with that, I'll transition to the next portion of the show, our interview with Michelle Miller. Michelle Miller is a clinician with the North Slope Borough Integrated Behavioral Health in Barrow, Alaska. She is a psychologist with a specialty in health psychology, which focuses on how biological, social, and psychological factors influence health and illnesses. Michelle has been working in the field of behavioral health for over 3 decades. She is known for her work with individuals experiencing severe and persistent mental health challenges, co-occurring disorders, and emergency psychiatric services. Michelle is a National Certified Counselor, NCC, Licensed Professional Counselor Supervisor, LPC-S, and a Master's Addiction Counselor, MAC. She is actively involved in community, state, and national organizations. Currently, she is an active member of the American Psychological Association, the Alaska Psychological Association, and the National Association of Alcoholism and Drug Abuse. Her clinical and academic specialties include training and certifications in evidence-based practices, cognitive behavioral therapy, dialectical behavioral therapy, and trauma-focused therapies. She is also a certified QPR suicide prevention gatekeeper instructor. Her goal is to educate, encourage, and enrich the lives of her clients and the community through her commitment to advocacy, mental health, family wellness, and leadership. She is passionate about her work and committed to the North Slope Borough Behavioral Health mission of supporting individuals, families, and communities on their journey to wellness.
Greetings to everyone. I am Dr. Michelle Miller. First and foremost, I want to thank you all, Behavioral Health Prevention Team, for providing me with this opportunity to increase awareness and decrease stigma and encourage those that are affected by PTSD to seek help. I'm a native of St. Helena Island, South Carolina. I was born 1966 to the parents of the late Jerome Miller and my mother, Matilda Miller. My father was a 100% disabled veteran of the Korean War. I am the seventh of 8 siblings. My parents did not have the opportunity to be formally educated. However, they instilled in us, their children, the importance of hard work and dedication.
Thank you, Michelle. Thank you for being here today, being willing to share your time and share your knowledge around this really important topic. With that, we'll jump right into the questions. I'd love to hear a little bit about what got you into this field and how you got to Borough.
First and foremost, I want to preface by saying that the company you keep is very important. Upon leaving high school, or maybe prior to, I asked my friends what were they doing, and they told me they were going to go to college, and I asked them to complete an application for me as well. And so we ventured off to the University of South Carolina. How I got into this field was my friends that signed me up for college with them. They signed me up for the nursing program. And I said, okay, I'll try the nursing program. And then I shortly concluded that I do not like the scene of blood. I do not like hospitals, and I do not like needles. And I was like, this is not the profession for me. And so then after 1 year of nursing, I changed my major to education. On my breaks from school during the summer and the winter months, I would go home and serve as a substitute teacher at the local schools. And I concluded this is not for me. And so then upon the third year of college, I changed my major again to psychology. And I thought this is perfect. So this has to do with teaching, and it has to do with the medical professional. However, I told my father that I had changed my major when he, came to dropped me off to school, and he was going to take a friend and I out to lunch. And after I told him I changed my major to psychology, he was like, "What's psychology?" And I said, "That's where people discuss their problems with counselors." And he was like, "No, people take their problems to the Lord and leave it there." And so I went up to take some things up to my room. And when I came back, he was gone.
Oh, wow.
And I asked my friend, "Where's Dad?" And he said he left. And so I thought that must have been a bit much for him at that time.
Yeah.
So, yeah. And so how I got to Borough was upon completing my doctoral degree, I was working at the local hospital as a psychiatric technician. And my supervisor told me that, "I think you need an adventure. I think you need a change. And I know the person that you would need to go and pursue your career with and have as a mentor." And so she recommended Borough, Alaska.
Wow.
It took like 2 years almost for me to be hired. And interestingly, I was hired and I came up and I met the deputy director of behavioral health that she had sent me up to Borough to be with. And shortly after, like a few weeks after, I came up in 2010 of September. And so a few weeks later, my supervisor had disappeared. And I asked, "Where is my supervisor?" And they said, "Oh, we had a mayoral election and she is no longer with us." And so I think my preservation was the climate, the weather, and everything in my brain froze. And I stayed. And she was, the person that I had come to be up here with, she had departed as a result of the mayoral election.
Yeah. Wow, interesting journey. So we'll move on to the next question then. If you feel comfortable speaking about it, do you have any direct experience with PTSD in your own life?
Yes, I do have direct experience with PTSD in my own life, post-traumatic stress disorder. I want to say that PTSD, regardless of background, demographics, or social status, we're all susceptible, or if we have direct exposure to a traumatic event, can be diagnosed with PTSD. My first experience, I would say, with PTSD was at the age of 9 when I lost my mother. She was preparing to go on a vacation with my father, and my sister and I were playing, and we heard a bang in her bedroom. Went to check on her, and she was on the floor unconscious.
Wow.
And so, of course, I ran and told my father that my mother was unconscious and he needed to come and check on her. He was in the barn outdoors, working on a car, getting ready for the trip. And he came in, and from then on, in those days, the EMS workers were, across the bridge. Like it took a while for them to get. But when they arrived, she was still unconscious. And so that was one of my experiences with PTSD.
Yeah, and experiencing something like that at such a young age, I can imagine that it has such a deep impact on you, right? And I think a really important thing about trauma, and a reason that I'm so happy that you decided to come on and speak with us, is that trauma is something that can have such lasting and deep impacts, and it really affects us in ways that we don't even understand, right? And I think as someone who has experienced my own trauma, oftentimes you don't even realize as you move through life that I'm acting this way, I'm thinking this way because of how trauma has affected me.
Yes, and on that note, it wasn't until later in life, she had expired. She was diagnosed with a brain aneurysm. And so, like I said, I was age 9 at that point in time. And then later on in life, I went to therapy in order to, like you said, get some clarification as to what exactly happened. Interestingly, the therapist focused on abandonment. And I don't know that that was really the situation or the diagnosis. I would say it was more of clarity, like what actually happened when my mother expired. And so to be able to process that is what I needed to do.
Yeah, well, I know that's a very vulnerable and personal story. So I just want to say thank you again for sharing a bit about that. I think, one thing that happens when we start to share our stories is that we normalize these events, these kinds of things, right? And we show people that, hey, you're not alone. There's other people who have gone through events, like traumatic events just like you, and you don't have to go through it alone.
Yeah.
So thank you.
And so one thing that we do in therapy is we complete an exercise called the trauma egg. And so your trauma egg can go from your childhood experiences all the way up to your adulthood.
Yeah.
And so with that being said, of course, during midlife, I had some other traumatic events.
Yeah.
And at age 42, I had another very traumatic experience where on a Labor Day weekend, I was called like 4 o'clock in the morning and told that my 77-year-old father had been incarcerated on murder charges.
Oh my gosh.
Okay. That was another very, very traumatic event.
Yeah.
It affected my identity. It affected his identity. It affected the family's identity.
Yeah.
Of course, the story was in the newspaper. Father was diagnosed with PTSD. He was a 100% disabled veteran. And of course, he kind of went back to his war days during that event. I worked on the psychiatric unit at the local hospital at the time. And so when I got that call at 4 a.m. in the morning, I was thinking it was my work at the hospital telling me not to come in because of the acuity. Well, when I went in to share with my supervisor what had happened, I had a physiological response to the trauma.
Yeah.
And I just kind of froze.
Yeah.
And I was not able to articulate.
Yeah.
But I was in good company. And so she allowed me just to cry and said it was okay. So interestingly, with that event, my family was just like in turmoil, and we were puzzled by what had really happened. We learned about it. And so with that being said, the next day, my sister attempted to go to work, and she was involved in a very a car accident.
Sorry to everyone, we just had a break in the audio, but Michelle, you were just talking about how your sister experienced someone going into a diabetic coma.
Yes. And so when I went to the hospital to see my sister, I was not allowed to go in the emergency room with her. It was only one visitor, and I asked what had happened. Interestingly, the individual that my father was accused of murdering, he and some other friends had evaded the hospital going after a patient one night. And so they changed the rules. And so again, I had to be confronted by a coworker that worked at the hospital security saying, Michelle, as the guy that your father was involved in the incident with, he came into the ER. And so we had to change the policy and procedure as to the security for the hospital.
Wow.
So that was some trying times for my family. And then a couple of days later, to learn that the individual that ran into my sister as she was going in to work, that was a neighbor of ours that we didn't even realize that was a neighbor. There was a jar in the store, my uncle's store that I went to, and it said we needed donations to send the remains of XYZ back to Mexico. And it was like, oh my goodness, that was a neighbor of ours. That was a pretty traumatic week, I would say.
Yeah, wow. That's a lot of events happening at one time.
One time.
Yeah, and you know what that reminds me of what you said earlier is that trauma, it doesn't discriminate against age, right? Like trauma can happen at any age, at any point in your life. So that really stood out to me. And another thing was that you talked about the physiological effects, which is something that we're going to return to later. With that, maybe we can jump into kind of talking a little bit more about the technical side of PTSD. Okay. So what is PTSD and what are the causes and symptoms?
Okay. I feel the need to digress and say as a result of the entire situation with my father that I went to therapy because, that is highly recommended.
Yeah.
And with my going to therapy and processing, that also led to me being able to free myself and to make the move of transitioning to Barrow, coming
Okay.
to Barrow.
Yeah.
So,
Thank you for sharing
Mhm.
that. So I'll just repeat the question. What is PTSD and what are the causes and symptoms?
PTSD is the actual exposure or actual threatened death, serious injury, or sexual violence. So that is the DSM-5 TR definition. Simplify it is PTSD is the exposure to any traumatic event that causes horror or fear. And it can happen in a number of ways. Veterans go to war, they experience PTSD. Someone might have a surgery in the hospital that's life-threatening. That might be a result of PT. Someone may have experienced a traumatic divorce. That can result in PTSD. And so often we think that, PTSD comes from an actual war veteran but PTSD, again, anyone that's exposed to any traumatic event can be diagnosed with PTSD.
And so these traumatic events, right? So it doesn't have to just be like physically threatening. It can also be like threatening emotionally and mentally as well.
That is true. That is true. And we can learn about events as I learned about my father's event. We can learn about events and be diagnosed with PTSD. There's also post-secondary PTSD, and that's where your first responders, day after day, coming into going on to crisis calls, and seeing individuals in distress, shootings, whatever the case might be, fires, that can also cause PTSD.
Yeah. Okay. Okay. And then the next question, how can PTSD affect our physical health?
PTSD, post-traumatic stress disorder, stress. Stress brings about an increase in the hormone by the name of cortisol, and cortisol can increase the onset of certain diseases. So stress most definitely impacts us. It can be like your weight, it can increase or decrease. It can be a physical effect such as teeth grinding, it affects your teeth. You might have hypertension or diabetes, your parents, PTSD, individuals, your eyes, sometimes your pupils are dilated. So PTSD can affect your physical health in a number of ways. It can also affect your health, hair loss as a result of stress. So there's a number of ways that PTSD can affect your overall appearance.
You talked about during your experience that you had kind of like a physiological experience, like kind of on the spot to the event happening. And can you talk a little bit about that and some kind of like physiological responses that you may feel when you are maybe reliving your trauma or when you're like experiencing trauma for the first time?
Right. So what happens is it affects your nervous system. And so there's usually 1 or 4 responses to acute stress. And that we refer to as the flight, freeze, fawn response, fight. And so with fighting, you might want to fight. Of course, that's self-explanatory. Flight is to run away. Fawn is to like please and not be able to move at all physically. And freeze, just not move, if you're terrified of something. And so these responses are automatic.
One interesting thing that I've read about trauma specifically in the nervous system, right, is that once you kind of like enter into this specific nervous system state, whether that's fight, flight, freeze, or fawn, it's really normal to continue to kind of get stuck there, right? And it's like you experience this nervous system response with one event, and then if you do not process it, you'll just keep on repeating that same pattern over and over again, and you find it merging into other areas of your life as well.
That is true. Working with the Department of Defense, one individual, if not 2 or 3, rape victims. And so, we process like what happened. And so did that happen again? Yes. Why did it happen? Because I didn't have the, coping mechanisms or strategies to be able to remove myself from the situation.
Yeah.
And so that's one of the goals of therapy, to be able to process and to be able to get yourself out of situations where you won't have to experience the same things over and over and over again.
Okay. So can you tell us now a little bit about how PTSD can affect our family, relationship, work, and other areas of our lives?
I spoke earlier a little bit about how it affected our family, being in the newspaper, on the news. And it was interesting because of the things that were printed or the viewings were like, who did that? Who said that? And we're looking at each other like, not me. No, I didn't. And so one thing my father taught us was like, you always stick together. And so our family was affected by my father's action. Also, in the counseling arena, what we kind of look for is the functional impairments. And so sometimes communication. For example, war veterans, they don't want to talk about what happened on the battlefield. And so communication, this often affects marriages, where it's like, what happened? Why is my husband not wanting to talk to us? Avoidance is another symptom. Why is he not going out with us? Irritability, agitation. And so these are symptoms that affect interactions with family members, problem-solving skills. Sometimes when you're preoccupied with certain thoughts and feelings, it's hard to process and problem solve. And then, of course, coping skills and decision-making. At work, I might, can't sleep at night. And so I'm not going to be able to make it the next day or the next day. And then, of course, I might, turn to substance to be able to sleep. And that makes things even more complicated, complex. So now why are you drinking or why are you using substances to mask these, or mitigate these symptoms? And so, PTSD symptoms affect all aspects of the individual's life or our lives. Leisure activities. I don't want to go out. I don't want to do anything. I'm feeling fatigued. I'm tired. I don't want finances, maybe overspending, or maybe we didn't have and not spending at all. And so these are the ways that.
What it sounds like is that PTSD kind of like creates like a web, right? That really touches all areas of your life. And
it does.
You might not even know, right? Like the reason I can't sleep at night, maybe you're just laying in bed and you're thinking you're so tired, but you can't fall asleep and you don't know why.
It does.
Maybe you find yourself kind of lashing out at people who are close to you and you're not really sure why.
Right. It can affect your entire lifestyle, your self-care, I don't want to go to a doctor. Commitment or responsibilities. I don't want to go to the child's school meeting or play. And leisure activity. I don't want to do anything about, stay home and isolate, pull the covers across my head.
One thing that really stood out to me, right, is this idea of like how PTSD can also be passed on to family, right? As someone who, my father was also a war veteran, I saw, just like the struggles that he dealt with and kind of have spent a lot of time thinking in my life how it got passed on to me and how it affected me and my behavior and my coping skills, So I was just wondering if you could talk a little bit about that specifically, like how PTSD gets passed on to families.
Native Americans refer to intergenerational trauma as ancestral trauma or trauma history. And so there are genes that's, formed when a woman is pregnant. And so, for example, if someone's using substances or smoking, that can, affect the sperm of a male. And so you're looking at your DNA, your genes, your cells. And also with intergenerational trauma, you look at the emotional response. Let's say, for example, domestic violence. If there's a lot of yelling and screaming, of course, there is a response, a response of distress, and that gets passed on to your fetus. And so you can be affected in that way. So there are emotional and psychological gene cells that get passed. Or just witnessing And so there is research that's being done as to if you have twins and one person were to relocate to another environment, or taken out of a home for foster as a foster child, and the other one's still in that environment, and the comparison of like how they can be so different, and how they can respond to things so different in life.
So, I think generational trauma, ancestral trauma is a subject which is very important, right? And I think it's very relevant, especially up here on the North Slope. And so that kind of leads me to two questions. I'll start with the first one, which is, do you know if there are any, I guess, like studies or things that, because you talked about how trauma can affect our genes, right? And how it gets passed down. Is there any kind of studies or knowledge on generational healing? So let's say, for example, you are someone who experienced, PTSD, or you experienced trauma growing up in your life, and you decided to get the help. You decided to heal and process some of those things. Would that have any lasting effects on future generations?
Well, most definitely, I would say knowing your history, knowing your culture is so very important. Knowing who you are, knowing your forefathers, what were their potentials and what they did and how they did things. And so as a clinician, we're expected to view at least 9 or 8 to 9 videos, or have conversations, interact with community members as to what what was experienced here. And so I think that's so vitally important to know your culture and know the culture of the people that you're working with, or the trauma that they have experienced, so that you can better identify with them and what it is that they're related to. In reference to recovery, here on the North Slope, I think it's so interesting that you have your Anupiat values. And so to implement those, when someone tells you a story about their trauma, you want to be open, and you want to be a good company. You want to listen, not be judgmental, not compare traumas. Like, oh my gosh, this happened to you. No, this happened to me. Trauma is trauma. Individual was exposed to whatever life-threatening event, what have you. And so being on the slope, for example, there's the Alaska Territorial Guard that had to go off to war, and do all the things that they have to do and come back to their families. And like, what were the expectations as a result of them returning? Of course, the Nupia people was very, very proud of them. But then when they came back, maybe some of them, experienced some of the same things in the 1940s. Some of the symptoms, like, why are they not talking, about what's going on? Why are they not wanting to be a part of the family events? And, family is very, very important part of the values and all. And so, yes, knowing about, what actually happens and the history is so vitally important. And working with people and being open, and for people to share with you, such experiences.
Is there anything else that you can tell us about PTSD on the North Slope specifically?
Well, we know that, there was decolonization where people were taken, from their parents. And so the stress of that, being taken from your loved one, however they love me, versus going off to, a boarding school. And we know that there was sexual abuse. You're not allowed to speak in your language. So to take away someone's language, take away your leisure activity, your dance, your hobbies, your sewing, your livelihood, your foods, that's pretty traumatic. That's taking away your identity. And so, to be able to recover, and then to recover with the use of your own values. It's just amazing.
And, I think that's so important, because it's like up here, Borough specifically is like a very diverse community, right? And
it is.
Within all of these different groups, like, culture is such an important part of our identities, right? And we all have like deeply rooted cultural values that really shape who we are and shape how we kind of see ourselves and interact with the world. And so, just like having that stripped away.
November is the National Native American Month, but like, we just need to study all the time. You can't get enough. And to be able to share the stories with the future generations to know the stories in order to tell the stories,
Yeah.
to hear the stories, and to be in the here and now and to have as much of that as an experience. Be mindful of who you are. It's amazing.
Powerful. So, how do you treat PTSD and what resources are available for our residents?
There's a number of ways to treat PTSD. First and foremost, we start off with assessment tools for safety, and that's the Columbia. And then there's also a number of other assessment tools we use, like the Alaska screening tools that identify did a person have TBI, traumatic brain injury, and so the number one therapy that the American Psychological Association, or one of the top, is EMDR, which is eye movement desensitization reprocessing. I'm not going to go into all the details of that therapy, but it's very powerful. You have the different levels of trauma. And so where do you want to start with this is your experience. And if we're not able to process, then we can put that traumatic event in a safe place until we meet again.
Yeah.
And we also have cognitive behavioral therapy that's used, and it's very effective with veterans as far as processing what actually took place. And I'm not going to leave out pharmacological therapy because we do have medications that assist with healing as well. Another therapeutic resource when it comes to healing, we have tribal doctors, and traditional health practices is another way for the healing of PTSD. I do want to say, as far as seeking help in our community, I do believe that there is no wrong door. So if you were to go to ICAST and ask for help and express what your needs are, ICAST is available and they will send you to behavioral health. You have the Samuel Simmons Hospital, and I do want to mention that we have our local churches that are active in our community, and the library, Tuzzy Library, has extensive resources as far as Native American history, and so those are wonderful resources that we can access in our communities. In addition to our elders, I think they are the greatest resources that we have.
And so these different treatments that you spoke about, are these available as well for our North Slope residents?
We, our director is certified in EMDR. We have National Care, which is a resource, refer you to emdr.org. And then we have the ANTHC, Alaska Native Tribal Health Consortium. And I do know that they have certified EMDR therapists, CBT therapists there also. And we do have staff on board here at NSB IBH, Integrated Behavioral Health, to facilitate care in reference to cognitive behavioral therapy as well as substance use disorder.
So for anyone who's listening who is struggling with PTSD or wanting to understand their trauma or wanting to seek help, how would they go about doing that?
As I said earlier, you can seek help in so many different ways. You have the EMDR organization that has lots of information that's of support. You have NAMI Alaska, and they're national and statewide. You have North Slope Integrated Behavioral Health, and you and me did complete an intake packet. That's the first step. Or the first step is just calling us and coming in and having a conversation. Often there's, or for the most part, there's paperwork, but sometimes we just need to have a conversation, because healing starts with someone being there to listen. And so often, people get what they need if they just have someone to listen for an hour without judgment and to validate what it is that they're experiencing.
Yeah, the listening and being heard, I think, is such a key portion, because when you are facing these internal struggles, it can often feel like you're so alone, right? You can feel like you're alone, or maybe you don't want to burden someone with kind of what you're going through. And I think just having someone to hear you and having someone to listen creates this sense of safety,
Yeah.
right? That, okay,
Mhm.
I do deserve to like talk about my stuff
Yeah.
and it is worth it.
Yes. We need to show each other more compassion
Mhm.
when it comes to how, we're affected by PTSD. And so, what passion looks like for you. First of all, show yourself some compassion.
Yeah.
Um, Whatever that looks like for you. If that's, starting off in the morning with a hot cup of green tea or going for a walk on the tundra, whatever it is that works for you. And then, secondly, the recommendation as far as PTSD is being able to mobilize yourself,
Mhm.
because so often those symptoms want you to, or have you to be just kind of all over the place. And so
Yeah.
if you can have something to ground yourself,
Mhm.
whether it's a rock from the beach,
Mhm.
like and painted, or saying the serenity prayer,
Mhm.
whatever it is that, you could find to ground you. And for each individual, that's different.
Yeah. Yeah. And so for grounding, it's like essentially having a practice or an object or even some words, right, that kind of just bring you back into the present moment, bring you back into your body, maybe when things are feeling really overwhelming,
Yes.
because sometimes when the emotion starts coming, it feels like you're in a storm, right? Or like a tornado and you can't find your way out. So just having something to help pull you out of that and
Have
bring
the
you back.
peace and
Yeah.
be still.
Yeah. I think that's very helpful and very powerful. So, so for my last question, if there was one thing that you can share with someone who is either struggling with trauma or PTSD, what would that message be?
There is help. You can get help, and you can learn to process those thoughts, emotions, feelings differently. Um, and just to know that there is help, you can get help.
Thank you, Michelle, for sharing your time and your insight. Now we'll move on to our weekly wellness practice. As I mentioned earlier, trauma is associated with a wide range of emotions, and for today's practice, we'll be focusing on fear. As with all emotions, fear evokes both a physical and physiological response. Physically, fear activates the fight or flight response, increasing heart rate, breathing, and muscle tension, and can also cause sweating and digestive issues. Long-term effects of living in this fear-induced fight or flight response include a weakened immune system, cardiovascular damage, and gastrointestinal issues. Psychologically, fear can cause heightened alertness, emotional distress, cognitive impairment, and behavioral changes such as avoidance. Fear has the power to stop us in our tracks. Fear has the power to keep us stuck in a loop of what ifs, I can't, and I'm not good enough. Today, we'll spend some time meeting our fear and quieting that voice with self-compassion. Stephanie Strauss, a meditation and mindfulness expert, states that with self-compassion, you become your own best friend. Learn how to have your own back in any crisis or situation and realize that you don't need to look to someone else for the answers. You feel whole and complete exactly as you are and have the wisdom and discernment to know exactly what you need and when you need it. Self-compassion teaches us more about who we are. It teaches us strength, resilience, and most importantly, opens the door to self-acceptance. We'll need a pen and paper for this exercise, so I'll give you a moment to grab them. Now we'll start by taking 3 deep breaths to find some stillness, to ground ourselves in our bodies and in the present moment. Breathe in through your nose all the way into your belly. Then open your mouth and sigh it out. Breathe in, sigh it out. Once more, breathe in, sigh it out. Now let your breathing return to normal. And we'll spend a few moments checking in with our bodies, noticing how we're physically feeling, emotionally feeling, mentally feeling. What sensations do you feel? How are your energy levels? Where are your thoughts going? Just notice what's happening and put a name to it. Try and keep that awareness going as we move on to the exercise. For this portion, we're going to do a little visualization. So I'd like for you to close your eyes. Think about a challenge that you're currently facing in life. Try to visualize the different parts of it. Who or what is involved? How do you see yourself reacting to it? What emotions are involved? Now imagine that you have a close friend or loved one going through that same challenge. Try to see their face. What are they doing? How are they reacting? How are they feeling? If there was one thing you could say to that person to help them feel cared for and supported, what would it be? Put it into a statement and say it to that person. How does that person react to you? Now open your eyes and write the statement down. Next, we'll bring that challenge back into our minds and read that statement out loud to ourselves. Let's just sit for a moment now and notice how it feels to receive love, support, and understanding from yourself. What emotions are coming up for you now? Do you feel relieved, grateful, happy? Maybe it feels uncomfortable if this isn't something you've done before, but being able to sit with our discomfort rather than running or hiding from it helps build strength and resilience. Spend a moment taking it all in. And now thank yourself for the support and know that it is available to you at any time. If there's anything from this episode that you'd like to learn more about, or if you have any physical, mental, or emotional health questions in general, please reach out to me by email at olivia.kim@north-slope.org or by phone at 907-852-0344 extension 4116. Thank you so much for tuning into the show. We hope you found it insightful and learned something that can help you on your own health and wellness journey. Next week, we honor Minority Mental Health Month with a discussion highlighting minority mental health challenges while celebrating the beauty of minority cultural values. If you'd like to catch the replay of this episode or previous episodes, you can visit the North Slope Borough Health and Social Services YouTube page. Until next time, Koyanakbak.